All right. Hello and welcome to Catalyst for Healing. My name is Dr. Yanuk. I'm here with Dr. Richter and Maria Lloyd, our wonderful therapist. And today we're going to be talking about a pretty important subject, and that is how to prepare for a ketamine treatment. This is going to be broadly applicable for any type of treatment, really, whether you're doing at home sublingual or intranasal or Spravato type of intranasal or IV, IM. Dr. Richter and I are much more familiar with it kind of in clinic use, but I think a lot of these are broadly applicable. So we're going to really narrow in on like the 24 hours before a treatment and try and talk about the important things that we will prescribe to a patient to kind of get the most from the experience. When I say prescribe, like recommendations. So I'll go to you, Maria, first. If you have a client that you know is going to be going through a ketamine session, how do you typically instruct them to approach kind of the day or two before to kind of get ready for it?
I mean, even though we talk about going it open, I do personally like the idea of people kind of just having some awareness of what's going on inside of them and being able to write out some type of intention. So let's say they're feeling themselves really worried about something, and so their intention is to surrender that, or you kind of pick something. I tell people like the opposite of whatever you're struggling with, but you want to get in touch with whatever's coming up that day or in that moment, and then try to release that before you go in, but also as part of your intention, you can hold something opposite of that. And then the somatic work and the breath work are really critical for just regulating your nervous system before treatments. So in addition to trying to have everything be calm and not be activated too much by news or, any type of stressful relationships the day before treatment, you want to be in like a calm, regulated state, and adding some type of meditation and breathwork practice throughout the day before treatment is very beneficial for that. Those would be things I can think of right now.
Yeah, and I think it doesn't have to be all of it, right? Like it's trying to find the thing that fits for you. But I like your general recommendation of just like trying to be more present and like being with yourself. And I think everything else can fall with that, like trying to remove social media, news, and all this stuff. So. And I'll get to that a little bit more kind of on day of. But Dr. Richter, why don't you talk about one of the more common questions I know I get, I'm sure you get it as well, is like substance use, whether that's marijuana or alcohol. How do you advise patients about that?
I would say that the whole prep before the sessions is really just to give yourself the best chance of get the most out of the treatment. And I feel like one of the merits of the treatment is to really get in touch with yourself, which I feel like is oftentimes really difficult when you obscure yourself with substances. And that could be prescription medications or other substances. Now, we're not saying to, stop your regular medications, but there are definitely medications that can definitely, and we have a whole list of them, right? That can kind of be somewhat not great to take right before your treatment or even the night before. When it comes to substances, I really feel like, this therapy has also been shown to actually have really good data behind substance abuse. There's actually some really good data and research going with that. So I would say if it's not too disturbing to you to not specifically pick up either infused daily marijuana or alcohol, without too much of a side effect from it, give yourself the best chance of not using these substances the entire time of the window of the treatment, especially the time before. And this may be somewhat anecdotal, but I feel like it can really obscure your own insight during the treatment. So I would say, yes, echoing to what Maria was saying, being able to focus on your well-being, being able to just sit with yourself at least the night before and do some more common things that we do recommend patients before they come in. Or we have a lot of resources for that, with a little bit of either just guided meditation, breath work, simplicity of just being with your own emotions before you walk through the door, instead of trying to silence or kind of disinhibit or otherwise alter your own emotional state of being the night before. I would say try not to with the typical substances that we use. That would be probably my most honest opinion. Now, if it's going to disrupt you so much that you are not going to even be able to present yourself, that's a whole different issue. But what would you recommend actually when it comes to prescription medications oftentimes?
Yeah, it's pretty simple. Like there's very few, if any, medicines that are absolutely contraindicated with ketamine, to the point where like I've never had a patient that's been on a medicine that I was like, oh, we can't do ketamine. It's like these medicines are so rare. And any clinic or any prescriber will know what those are. I think most people, though, kind of the medicines that they're on, whether that's antidepressants or anti-anxieties, I recommend them to continue on those medicines. And really the goal is not to have you immediately withdraw from these medicines, but to basically show you how you can start to heal and then slowly taper off of these medicines in a safe, controlled space. I'd say the exception that I make to that is with benzodiazepines. If you're on something like Ativan or Xanax, and especially if you do it really on an as-needed basis, maybe a couple times a week or something like that, or for sleep, I'll try and encourage patients, especially after their first one, to like, hey, maybe hold off on the nighttime dose of the Xanax, right? See how you feel, because really what we see with benzos is there's not necessarily evidence that it makes the medicine less effective, but the experience is for sure blunted. And what we mean by blunted is you're just oftentimes less visual, less intense. And so I think a lot of people look for kind of a more deeper experience. And I think with benzos, we see that not be the case as much. But with that said, we also will have patients, it's rare, but we will have patients that we will actually pre-medicate with a benzo. Like the only way they're going to come into our space and feel comfortable, because they're already so anxious, is kind of calming them down with medicine. And I used to feel really hesitant to do that, but the more I've found the right patient for that, it's like, wow, it completely unlocks something with them. And then it's interesting that over time, second, third, fourth,
we
are able to kind of come back in. But it's like meeting them where they're at, and then slowly coming off of it. And that's how I think about substances as well, right? And so with like marijuana, for example, if someone's using marijuana daily, like if I tell them to stop, they're going to have withdrawals, and that's going to for sure affect their experience. And so I try and have them, taper off basically in a kind of a controlled prescribed space. And it doesn't have to happen after the first one. Just see if most people, it just feels natural and they want to come off of these things.
But that's the one I have the biggest problem with, because I would say the majority of my clients use to pot. Use it every day. And there's a lot of resistance to even holding it for a day. But what I've noticed is if I can help them understand that they're going to get more benefit from the ketamine, they're able to hold it the day before and the day of, they will. And then, that's why this is working for addiction, because they will start to get the benefits of the ketamine and not feel the cravings as much for the medicine or the pot. So,
and it's also, not to go too far in the weeds, but it's important to try and understand what people are using substances for. And so whether it's alcohol or whether it's marijuana, there are some people that it really is purely like a very social recreational thing. And like, I'm not going to be the narc doctor that's like, oh, you can't have alcohol on the weekends, right? Like, we are living humans that like want to recreate and be around people and enjoy our life. But I also think there's a subset of people where that is not the case, and they are using it to self-medicate. And that's the person where I think I can connect more and try and discuss with them how that this is actually probably making your symptoms worse, and how this thing that is a known depressant is probably depressing you. And therefore, if we can kind of pull that back, will probably help you. And most people are pretty responsive to that. I think also coming from us, I think is helpful too, versus like kind of a traditional like white coat doctor that's like, all drugs are bad and you can't do drugs, right?
Right.
Okay, so day of infusion, right? Probably everyone has a crummy night's sleep the night before, especially the first infusion, but typically before an infusion, they're just nervous, right? Yeah. That's okay. Like, that's totally normal. Right. I can't tell you many patients I've had call me like, I'm not sure if I should come in. I didn't sleep well last night. I was so nervous. And it's like, it's okay. Like, your body's telling you you're about to go through something that's intense, meaningful, and like, this is exciting, right? We don't need to approach this with fear. Like, you're about to do something that's going to hopefully change your life.
Yeah.
How do you talk about sleep? And like, how do you, because it's such a tricky thing, right? Like this, but how do you talk about it both before and after? Do you give recommendations on that?
Yeah, I always do, because sleep is, it's just the number one, like, important thing for mental health.
Yeah.
So, I mean, we don't want that to happen more than that first night, hopefully.
Yeah.
But I mean, I do have people take natural things like magnesium or L-theanine. You talked about melatonin a little bit, but a lot of my clients are on sleep medications too.
Mm-hmm.
And so either they're just aware of continuing to take those, but that's something they can also taper off once I think they get more regulated in their nervous system. If they've done some of the trauma work and the healing, their sleep tends to repair itself as well.
Yeah.
But I always feel like that's a big focus for me, is making sure they are getting the sleep.
Mm-hmm. Yeah. But also just like not putting too much pressure on it.
Yeah, definitely.
Like I said, knowing that first night, sure. But I don't think after the first time they're that anxious anymore.
Rarely. Unless it was like a particularly intense first time, but rarely. All right. How do you talk to patients about food, activities, things like that before? Let's say
I was about to ask you that one.
That's got an infusion at 1 p.m.
Right.
In a perfectly ideal world, how would you schedule their day?
In a perfectly ideal world, I would actually schedule them midday. And that can be
I think
pros and cons, right? Because sometimes for just medical reasons, we have patients fast for 4 hours before the infusion.
Mm-hmm.
Now, that's when it comes to solids. Liquids, look, we tell everyone 4 hours before, NPO, nothing orally. Realistically, we're mainly talking about solids. With liquids, it can be a little bit of a wiggle room. But yeah, patients will obviously be in a different state of mind if they're not eating all or drinking all day, because they're anxious and they're trying to time themselves a little better. So I would say midday, because if you have semi-normal, sleep regime and you are waking up in the morning, you are able to have a light breakfast. I would say this is more of a common sense. Light things, because this medication can make you feel somewhat of a out of body and maybe even floating sensation. And again, we use medications to augment it, like nausea medication, but a light meal and then lots of hydration the night before and decent hydration the morning off. And then it just sits you much better, the prehydration, because the last thing, you want is you're dehydrated and, maybe, your veins are as, plump and full as it would be in a hydrated person. All these things are pretty easily actually taken care of if you just hydrate the night before, have a light meal for any kind of sense of nausea or anything like that, and hydrate the morning off.
No.
What also midday through allows you to do is then it really allows you to keep integrating the experience later on in a day. And that's something that I feel is valuable for patients. I'm not saying that I don't even know whether there's any data on time of administration of the medication, but I feel like there is merit in being able to sit with those emotions, with the experience that you've had, and being able to still process it the day off before you integrate it, hopefully, ideally the next day. So I'd say light meal, lots of hydration, and common sense things about, substances that we talked about. So midday tends to be good, but it also works different for different people depending on their sleep regimes. Yeah.
Yeah. Or in life. Some people are can only come after work. And I think this is like we have a lot of these, I think obviously in the ideal world, like, you've got the day to really be present and intentional, and you're getting a massage, you're doing, like stuff that's like really wholesome and stuff, but like, that's not the reality where most people are at, right? They've got families, they've got work. And so I think if you could even just give yourself a beat to transition between your world and then this new world, and it doesn't have to be much, it doesn't have to be hours, it can be 5-10 minutes of just breath work in your car before you come in, like of just deliberately like, okay, like I'm transitioning out of the office and now I am here and this is my time. And then hopefully the clinic will be able to guide that kind of that full transition and get you into it.
Right.
But the last thing you should be doing is scrambling to get into the clinic, running late, and be like, oh, okay, give me the medicine, right? Because that is a recipe for a non-ideal experience.
Right.
Yeah.
The other question that I sometimes get is directed at you because you're pretty active, like physical activity.
Yeah.
Maybe before the day off.
Yeah, definitely. For sure, I'd encourage it. Before, yeah. I've obviously I've evolved a lot in this space. I really encourage patients to, just listen to their body, but even with food, I'll do food, typically 4 hours before, but with hydration, I want them to hydrate all the way up through it. And I think not only for, because we do a lot of IV, but not only for that, but I think it reduces their side effects. There's literature in the operating room with patients like hydrated more in the post-operative nausea, and I think it translates to our patients as well. Yeah. The more hydrated you are, I think in my experience, the less likely to get headaches, less likely to get nauseous, more likely to get an IV, and also it's just a healthier way to be. And so I have them hydrate all the way through. I don't give them any limitations on water. I mean, you and I are both ER doctors. I'm not concerned about this theoretical and extraordinarily low aspiration risk. It's something I can have that conversation with patients, and at the end of the day, I think we're able to come to the same conclusion that we'll take that really small risk to make you have a better experience and feel better afterwards, right? But ultimately, you gotta listen to your clinic, and I suspect most clinics are pretty hard on that, and like no food or water beforehand, but that's just not how
aspiration risk.
I mean, right? That's really what it is. So the idea is that in an ideal world, when you give anyone some type of this comes from the operative literature. Ketamine is an anesthetic.
Yeah.
And so if you're giving someone high doses of ketamine to anesthetize them back in an operating room, the last thing you want to do is have them throw up when they can't protect their airway, right? And then it can go back down into their lungs and can cause an infection or, to choke and things like that. And so that's really the whole idea behind, from a safety perspective, why we want that stomach empty. Gastric emptying time is typically 2 to 3 hours, and that's where all literature goes. Dr. Richter and I have intubated thousands of patients in the ER who literally seconds before had flaming hot Cheetos, right? I'm joking, seriously, and the amount of times that we see aspiration, we probably count on 2 minutes. It's just so low. Of course, we want to try and prevent any of these risks,
right?
But at the same time, I think
they're really out. It's kind of you're not.
You get out and said we medicated with enough medicines, but I think in an effort to protect against these real outlier cases, we are making the majority of people have to suffer needlessly. That's what I've evolved in my thinking about it. And then the power of an informed consent of I can talk to a patient about this, talk about these risks, and then they can determine, okay, you know what? That kind of sounds scary to me. I think I'm just not doing well before. And I'm still that sounds like really low risk based on what you're saying, and we'll do it, right? And that's how in an ideal world, a lot of it goes today, right? Okay. So we talked about medicines, we talked about food, diet, sleep the night before, mind space going into it. How do we get from there? What should patients do the hour before if they're kind of gearing up for what it is?
Yeah, I think that's where the journaling can be really helpful. So just having, like you said, that space. Well, one, to break down your nervous system with whatever breath work you could do and meditation before going in.
Mm-hmm.
But your clinic has meditation that you guide them through. Some probably don't. But you really want to be present with what's coming up in that moment. And so if you had a journal, or even just speaking into your phone, if you have Google Docs, you can open and say, here's how I'm feeling right now, and just try to be present with whatever it is that's coming up. That's going to give you the best outcome. Really.
Okay. Last thing with the intention setting, you can tell us about that. I'm curious what your take on this. I think you have an opinion. What's the intention, and then how do they approach that intention setting during the infusion?
So again, I like to have people set intentions loosely. So let's say the cardiac journaling process is whatever they're realizing that's going on inside of them. They're saying, oh, I really need more peace today, or I really need more hope in my life, or need more, I don't know, happiness, whatever it is. They could have that be the intention of what they want to feel coming out of it. But when they get to the infusion or the medicine taking part, it's I love the thing you said, trust, let go, surrender. This is your acronym.
Oh, yes. Yeah, that's going to be open.
Okay, trust, let go, be open.
But maybe it should be surrender.
So I feel like there's a space for both.
Yeah.
I think you don't want to have this harsh, like, holding on to intention.
Yeah.
You're going to solve this puzzle and heal this trauma when I go. Because it just doesn't work that way. The medicine will bring up whatever is in the subconscious moments, and whatever's live and active in your body is going to probably come out in this journey.
Yeah.
But I think there has to be that element of also just letting go. What were your opinions on that?
Universe. I think setting an intent, I mainly just focus on, and I like that, like drawing them their mind as a blank canvas, and then introducing something, oftentimes, a positive space for themselves. They go into the infusion with either imagining an abstract or a real place that's comfortable for them, where they feel safe, as they're actually doing breath work going into the infusion, as they're already sitting in the chair, or a positive aspect of themselves. Sometimes I actually have them think about it the night before, and then you write it down. I've had it, where I would, the patient would come in the next day after we talked about it. They bring it with you, and they can take it into the infusion with them. Sometimes also bring a talisman. It seems silly, but it can oftentimes actually work as almost an intent, something that they feel comfortable with. It could be a plush animal. It could be anything.
Yeah.
Something that allows you to feel comfortable with yourself enough to actually go through TLO. I love it, or TLS.
I like that. I haven't done incorporated that too much. I think that's a really good idea. The talisman thing. I like that a lot. Yeah. I think intention setting is critical, but I think educating people about what intention setting is equally critical.
Yeah.
Because I think a lot of people's perception of having an intention is, if they don't hold on to that the entire infusion and feel that way afterwards, then they fail.
Right.
And I saw that so many times early on in my career in this space that I initially kind of reacted against it. I was like, oh, I'm not sure intention setting is the right space. And then I've come full circle of like, it's like, okay, it's obviously more complicated than that, and we need to educate people about it.
Right.
And like, I mean, it's very obvious when your clients come in, because they get that deeply. But I think a lot of people, they hear intention setting on the internet, or they see it, and then they come in and they're like, my intention setting is to like feel love. And then they come into it and they maybe just wait, and they're disappointed. And that's where I think, it's just a very delicate balance. I think it's super important, but I think sometimes it can set people up to feeling like they didn't satisfy what they were trying to get from it.
Yeah.
It would be a wonderful thing to study. And honestly, maybe it has been studied. And actually, to be honest, I'm sure it has in not the ketamine space, but at least probably like psilocybin MDMA. I'll have to look that up. And if I find something, I'll link it on the show notes. It's not something I've looked up intentionally. Okay.
So, question to you though,
Yeah.
because you beautifully evaded it.
Yeah.
You focus on something concrete or something very abstract, and let them actually, when it comes to intent, going into the session.
Don't really guide their focus per se. I just try and get them to be present, and like whatever that's going to be is going to be. And like, really, it's like breath work. And like, I think in an ideal world, I get them to a point where their mind is completely empty. It's like,
yeah, yep.
It's unrealistic, but like, that's really what my goal is. And so especially in the way most clinics, ours included, are set up, like, I think the less I can do, the better. Like, when you come in, me bombarding you with a bunch of stuff is just to take you out, for the most part, of like the world that you just tried to kind of create for yourself. And then when they come in the chair, if I try and take them somewhere else, like, who knows what they just did with their therapist and stuff like that, like, trust them. And like, I'm going to make sure you're safe. Try and open up, just let it go and roll with it.
Yeah.
That's what I try and do for the most part.
No, that's,
But I would say, yeah, it's a really cool space to be in, because a lot of this is really the art of medicine. And there really isn't like a hard and fast, like, you have to do it this way. And we work with so many different patients that we see that what works for one person doesn't work for another one. Like, some people really need their hand held the whole way. But like, what's the point of this one? Sure. Okay. Anything else we're getting at?
That's pretty therapeutic.
Yeah, okay. So that's it. I mean, I think that's a relatively decent summary of like how to prepare for a ketamine infusion or ketamine treatment, I should say. There's probably other stuff that we're missing. And if there's more, maybe we'll add an addendum to this video in the future. But that's all for now. We appreciate you joining us, and we'll see y'all next time. Thank you. Bye.
Bye.